Okay, so now I'm going to be doing my redo integration for Jamie Carson, my Foley catheter. So here's my penis. I've got 2 sets of sterile gloves. I'm not sure if there's some sterile gloves in this kit. So I got 2 pair, and then I've got my washcloths that I'm going to be using to clean my patient. And then here's my patient here. I've got him out of the way so that he's not really in the view of my camera so I can have space. But this is Mr. Jamie Carson. He's an 18-year-old male. He's going down to get an appendectomy. So the doctor has ordered for him to have a Foley catheter inserted prior to surgery. So we're gonna go ahead and insert the Foley. I'm gonna go proceed by, I've already let him know what we're doing. He's aware, and we're gonna go ahead and start the peri-care. So I'm gonna go ahead and put on my gloves. I'm gonna put on my gloves and I'm gonna perform peri-care. So I'm gonna use 1 washcloth and I would dip it into my basin of soapy water. And I'm gonna go ahead and clean the patient's penis. If they had any foreskin, I would pull the foreskin back, but my patient does not. So I'm just gonna clean around the meatus of the penis. So I'm just gonna clean 1, and I use the 4-fold method. 1, fold back, 2, hold back, 3, and 3 is good enough. And then I can dispose of that, and then I'm gonna go ahead and rinse with another. Do the same thing, 1. Oops, I used the wrong side. 2, 3, 4 to rinse, and then I'm just gonna use the other side to pat dry. Okay. And once I've done that, I can discard of those and I can get ready to go sterile to begin inserting my Foley. So I'm just gonna move this out of the way a little bit so that I can have space to open up my kit. I'm gonna go ahead and remove these gloves. Then I'm gonna go ahead and start opening my kit. Now when I open my kit, I'm gonna be using the 1-inch borders. And I'm also noting that this is a 16 French Foley catheter. Right there. Okay. And this, I can just note what it's for, the insertion time, date, and then this is for pre-op and things of that nature. Okay, so when I open my kit, I'm gonna be using my 1-inch borders. So I'm gonna start out using my 1-inch borders. So I'm going to, and I know my table isn't gonna be big enough to fill the whole thing, so some is gonna be kind of hanging off, but I'm gonna be making note of the sterile because it's not big enough for the table. So I'm going to go ahead and just hold here, and then hold this, and I'm gonna hold here. Using the 1-inch borders. Okay, and I'm using the 1-inch borders to open it. Okay, so I'm gonna go ahead and open up my gloves, and I'm not reaching across my field. So I'm just gonna come over here a little bit, open my gloves, and I'll open them away. And again, I'm going to move this over so it's not touching my field, and I'm using my 1-inch borders. I'm going to put on the right hand, which is my dominant hand first. I'm just going to grab the cuff. Okay, then I'm going to grab inside of the cuff here. Okay, and then I'm just gonna push this out of the way so that I can have space, but I'm keeping my hands inside of the sterile portion, and I'm just gonna discard of that over there. So now that this is sterile, I'm going to pull my penis back into the camera. So I'm staying sterile, but I'm just moving this over so that we can see it. Okay, so now I'm gonna go ahead and I'm going to grab the drape. I'm going to drape my patient. So I'm just going to place this in between my patient's legs. I would not touch their skin. I'm not touching the skin at this point, but I'm just draping them using the drape. Sorry, I'm trying to make this go under there. But I would not touch the patient's skin, just so that I can hold that in place. That drape would go there, and then there is some more towels so that I can clean my patient here. So I'm just gonna place these over there and place this over there and proceed to open. Oh, there are some more sterile gloves in here, but I've already got some on. So I'm gonna go ahead and keep these over here. Okay, and then I've got another drape, and it's a fenestrated drape, so I'm gonna go ahead and drape my patient without touching them. Okay, once I've done that, I can now start with my kit. I'm gonna move this, and I'm being mindful of my 1-inch borders, keeping my hands above my field. So I'm just going to place this here, being mindful of those 1-inch borders still. Okay, so I'm gonna go ahead and I'm gonna set up my lubricant. Okay, then I'm gonna go ahead, and if I needed to collect a specimen, I could. I've got my swab sticks here that I'm not really gonna open because it's gonna make a mess. So I'm gonna go ahead and check my Foley balloon, so I can go ahead and remove this. Okay, and I'm just gonna leave that there. Okay, so now that I got this, this is a 16 French with a 10 ml balloon. So I'm gonna go ahead and do that and inflate my balloon, making sure there's no leaking, no holes. And once that I see that, I'm just going to leave this in my kit here. I can go ahead and deflate it. And I'm gonna leave this here. Before I do that, I'm just gonna go ahead and lubricate my catheter and then place that in there so that it's not flying all around. I'm leaving this here. Okay, so now that I've set all of my kit up, I'm ready to go ahead and clean my patient with the swab sticks. So I would open this up. I'm gonna take one swab out, and once I go ahead and put my left hand on the penis, my left hand will stay there. So I'm just going to turn it this way so that I can see, and then I'll move over this way. Okay, so now that I'm ready, I'm gonna go ahead and grab my patient's penis using my left hand, and I'm not going to move. Sorry, I'm trying to make sure you can see. I'm gonna place this over here for the time being. Okay, so I would go ahead and hold on to my, and I'm gonna turn it this way actually, so that you can see. Okay, so now that we can see, I'm going to go ahead and turn this way. No, but then you won't be able to see me staying sterile. This is so much harder. Okay, so this is my penis. My patient's draped. I'm staying sterile. I was just trying to fix my camera and stuff. So I'm going to keep this left hand on the penis without removing it once it is there. So now this left hand is not going to move. Okay, so I'm going to come over to my kit. I've done my, I've got my swabs. So I'm going to take one swab. I would clean around the tip of the penis, discard of it, grab another, clean around the tip, grab another, clean around the tip. Wait for that to dry. If I wanted to dab it dry a little bit, I could. But I'm just going to let it air dry a little bit. Then I'm going to go ahead and grab my catheter. So once I grab my catheter, I'm going to grab it. Okay. And I'm going to place it here. I've cleaned my patient's penis already. So when I insert it, I may feel some resistance, and that may be the prostate. I'm gonna let that calm down a little bit, and I'm gonna keep advancing my catheter until I get to the bifurcation, until I see urine come back into my my catheter and into the bag. You'll start seeing the urine, but I'm gonna make sure I advance my catheter all the way to the bifurcation. So I'm gonna go ahead and proceed to insert the catheter. I'm gonna hold it at a little bit of a 90-degree angle, And it's already lubricated, so I can go ahead and insert it. And this right hand will not touch my patient's penis. So I'm advancing the catheter. I'm advancing, and I've hit some resistance. So I'm gonna stop, let the prostate calm down a little bit, and proceed. I'm gonna continue to advance my catheter, continue to advance my catheter until I have hit the bifurcation. And I'm continuing to advance my catheter, continuing to advance my catheter until I have hit the bifurcation, and I have. So I see some urine coming back. I'm going to make sure it's in. Okay. And I actually got it to work this time. So I see the actual fluid, and I see the catheter actually made it into my pipe here that I always struggled with in all my other Foley videos, but it finally worked this time. So I've made it into my bladder, and I've advanced it to the bifurcation. So now I can go ahead and inflate my balloon. And I'm staying sterile, but I'm just gonna move this so that we can actually see what it's doing in the bladder. So for the video's purposes, I'm just gonna deflate it and remove the drape a little bit. But I'm staying sterile and keeping this hand on the penis. And I'm just gonna pull this up a little bit so that you can see what I had been trying to do all these times. Okay, so now I'm gonna inflate my balloon. And it's inflating in the bladder. Can you see that? You see that? It's inflated in there. Okay, so now that I've done that, I can go ahead and detach this. Once it's there, I'm gonna go ahead and remove that. Okay, and then I'm gonna go ahead and pull back on it until I get resistance. So I'm gonna pull back, and I've hit resistance. So now I know that this is in the bladder and not in the prostate. And I'm gonna, now I can come on sterile because my procedure is done. I'm going ahead and take my scat lock it to my patient's leg using the adhesive, and then attach my bag to the designated spot on the bed. But I'm super excited about this. So I'm no longer sterile. So I'm gonna go ahead and show you how it is, what I've been trying. So it's like in there, and I know that it's in the bladder. I've pulled it in till I got some resistance, and there is how my catheter would be in my male's insertion. Thank you.